It is a place that millions visit to go work out, but the gym could actually be harmful to your health. On this week's edition of Today's Health, we find that germs are lurking in every corner. Haley Hernandez has some tips on how you can avoid getting sick.
The most common type of infection waiting for you to finish your reps: staph.
If left untreated, can create an infection in your skin where it would swell up, maybe cause pus.
Dr. Irvin Salapa says the #1 rule that gym goers should follow to stay healthy is to wipe down the equipment with alcohol or antibacterial wipes.
Sweat drops going into, like the meter machine on the treadmill. So sometimes, you should just try to wipe down things where you think you potentially have skin contact, but also like sweat contact.
Sweat can carry infections like staph or athlete's foot. Fungus tends to like living in warm, moist environments, and during a workout, your sweat is creating that. So don't forget to follow these rules to avoid germs at the gym, and tell your student athletes also.
Don't reuse towels. I recommend showering right after any exercise or any workout or any practice. If they carry things in a gym bag, make sure you have like a deodorizer or anything that keeps your gym bag clean.
In other health news this morning, most larger dose opioid prescriptions are not coming from hospital emergency rooms. A new study from the Mayo Clinic looked at millions of new opioid prescriptions written for pain. Prescriptions from the ER were less likely to exceed a 3-day supply than those written elsewhere. ER doctors are also tended to prescribe a smaller dose, and patients who got opioids in the ER were less likely to use them for a long period of time. Another new study finds depression treatment is not just for the young. Researchers followed over 2,200 adults diagnosed with depression. Although older adults were more prone to severe depressive episodes, they responded well to treatment. In fact, seniors showed improvements in their overall quality of life after treatment, similar to younger patients. Finally, weight loss can lead to significant cost savings at any age. A new study from Johns Hopkins calculated yearly medical costs and lost productivity linked to obesity. For example, a 50-year-old who goes from being obese to normal weight could save more than $36,000 over his or her lifetime. Even going from obese to overweight helps lower medical costs. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.